Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Traits of Alice in Wonderland Syndrome. AIWS Episodes. Alice in Wonderland Syndrome, AIWS, is a set of brain-related symptoms involving your brain's sensory ability. AIWS most often affects children and adolescents with certain neurological or brain disorders, such as epilepsy or Epstein-Barr virus, EBV, infection. In adults, AIWS most often presents as migraines with aura and headache attacks preceded by sensory distortion. /r/n/r/n AIWS episodes change how you perceive the size of things around you, the look and feel of your body, your sense of self, and the passage of time. AIWS takes its name from the character Alice, who experiences drastic changes in her body's size in Lewis Carrolls' imaginative novel, Alice in Wonderland. /r/n/r/nMaskot, Getty ImagesrnrnrnBecause Alice in Wonderland syndrome is under-researched, its exact prevalence is unknown. However, it affects about 15% of people with migraine. In a study of adolescents, 5.6% of males and 6.2% of females at birth experienced symptoms. /r/n/r/n throughout the novel Alice in Wonderland, the main character, Alice, experiences distortions in her sense of reality and time. At one point, she shrinks to the size of a mouse before growing to the size of a house. The primary symptoms of AIWS episodes involve similar perceptual changes. /r/n/r/n AIWS episodes typically are brieflasting as little as a few minutes and rarely over a half hour. However, there have been reports of episodes lasting months or years. Broadly, effects can be categorized as affecting self-perception, vision, and other senses. /r/n/r/n changes in your sense of self and body are standard features of AIWS. These symptoms include /r/n/r/n AIWS can also affect vision, distorting what you see. Among many, the following are the most common: /r/n/r/n some with AIWS report everything sounding louder and more disruptive. This condition can also cause coordination problems or loss of limb function. /r/n/r/n episodes are not harmful in and of themselves, but they can have a broader impact. For instance, they can cause emotional disturbances and impact the ability to remember and learn. Self-stigma. Negative feelings or ideas about yourself can also arise due to anxiety about episodes, impacting social interactions and relationships. /r/n/r/n It can be challenging for healthcare providers to diagnose AIWS. Episodes are brief, the condition is understudied, and no set criteria define it. To do so, healthcare providers, often neurologists, brain specialists, use physical exams, health history, and neurological tests to assess how well you see and move. /r/n/r/n Since a range of physical, neurological, and psychological conditions can cause symptoms like AIWS, providers may also need to perform additional tests and exams, such as /r/n/r/n if you suspect you or someone you care for is experiencing sensory disturbances, seek medical care. Caregivers of children with suspected AIWS should track the timing, duration, and intensity of episodes, since answering questions about episodes is a crucial aspect of diagnosis. /r/n/r/n Researchers are continuing to study AIWS to understand its cause. Many experts believe it arises due to problems with the structure and function of the perceptual system, the eye, optic nerve, and associated brain regions. Using imaging studies, researchers linked cases to disorders in the brain's visual cortex. /r/n/r/n A growing list of conditions can trigger AIWS episodes and raise risk. These include /r/n/r/n There is no standard treatment for AIWS. While most episodes are temporary and resolved independently, management strategies focus on treating the underlying migraine, infection, disease, or psychological condition to stop them from coming back. /r/n/r/n resting until an episode passes is critical. Remind yourself that what you're seeing and feeling can't actually hurt you. If your symptoms are caused by migraine with aura, several methods may help manage symptoms, /r/n/r/n depending on the cause of AIWS, there may be little you can do to prevent episodes. Still, managing potential underlying causes, such as migraine with aura, and promoting good mental and physical health can help. Here's what may help between AIWS episodes, /r/n/r/n while AIWS episodes are temporary and harmless, these symptoms can be signs of more dangerous conditions. If you experience any stroke symptoms, seek emergency help. These include /r/n/r/n. There's no doubt that conditions like Alice in Wonderland syndrome can be a significant burden, especially when it's associated with a chronic condition. If you or a loved one is struggling, seeking additional support and resources is important. Here's what you can do. /r/n/r/n Alice in Wonderland syndrome, AIWS, is a rare neurological condition that affects sensation and perception. Migraine with aura is the most common cause. Managing AIWS involves treating the underlying cause and resting while the episode passes. Most cases are harmless, though living with the condition can impact the quality of life. Prevention may involve lifestyle changes to prevent associated conditions, such as migraine. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.